The so-called Big Beautiful Bill is headed to the president.
And President Trump plans to sign it tomorrow. But an Oklahoma doctor says it spells disaster for some of his patients.
News 4's Abigail Franklin joins us with details. Abigail, 80% of his patients are on Medicare or Medicaid.
The majority of them are Sooner Care, and that's Oklahoma's version of Medicaid. And while he doesn't know right now how many of his patients will be impacted, what he's certain about is access to health care for Oklahomans will take a major hit.
I'm very sad that a good portion of my patients could lose their coverage, especially if they have a lot of healthcare needs.
A mega bill proposing tax breaks and spending cuts narrowly passing.
The motion is adopted.
And Medicaid is on the chopping block.
This just makes it even more difficult. Now you're tossing more people out. You're creating more people that might not have any coverage at all.
More than 1 million Oklahomans are enrolled in Sooner Care. The bill will require enrollees to prove they're working. Red tape that could lead to Oklahomans foregoing health coverage.
They're getting more and more aware that up to 25% of them would lose their coverage. That'd be more like a fourth of my patients just can't come in. So if I see 20 patients a day, that's 5 less patients a day. That's pretty significant.
Oklahoma hospitals are also at risk when cuts begin. The Oklahoma Hospital Association says hospitals will lose Medicaid reimbursements, money that keeps them afloat.
We're concerned that when fully phased in, $6.3 billion in Medicaid reimbursements will be taken away from the state of Oklahoma, and it will be hard to recover from that.
Senate GOP leaders added a fund for rural hospitals, but health experts say it might not be enough, forcing closures in areas already lacking health care access.
The impact that these cuts will have on the actual providers of those services that may no longer be able to provide them.
These cuts stem from the federal government working to cut waste, fraud, and abuse to Medicaid. Dr. Sinton says he's fighting the misconception that Medicaid patients are scamming the system.
They're just less fortunate families, many of which are hardworking and hold 1, 2, or 3 jobs. Many have children that have special needs and need a lot of specialists and need pediatric care.
The Oklahoma Health Care Authority told me that Sooner Care is a shared investment between the state and federal funding. 68% of that funding is from the federal government and only 11% comes from the state.